How is mast cell activation syndrome connected to our mental health? One of the most common requests I get is to talk more about the connection between histamine, mast cell activation syndrome, and common psychiatric symptoms. Now, a simple search on databases like PubMed shows that clinicians and researchers alike have been documenting the correlation between conditions like MCAS and mastocytosis with psychiatric conditions like OCD, panic disorder, depression, generalized anxiety, alcoholism, and even psychosis for many years now. So this is not a new concept. Ever since people have been documenting symptoms of mast cell activation syndrome, they've been correlating it with these psychiatric symptoms. So the question is not if they're correlated, they absolutely are, but the question is more, why are they correlated? So why does mast cell activation syndrome cause such dramatic shifts in our mental health? And let's talk about the steps you need to take to address this. So if you're living with MCAS, I'm preaching to the choir. You already know that this isn't just about getting hives or having food reactions. The symptoms show up in your mind, in your mood, in your ability to think about things clearly. Many people with MCAS are initially told that they don't meet the criteria for any autoimmune disease, but rather they meet the criteria for anxiety disorder, panic disorder, or even OCD. But what's really happening is that mast cell activation and elevated histamine are affecting the brain and nervous system directly. Before I dive more into the science, I want to share a little piece of my own story that some of you may have heard already, but I think it's important to share. When I was in the thick of my mast cell activation syndrome, when I was at my worst, this was back in 2025, 2026, one of the hardest parts was the way my brain felt hijacked. I had always had underlying generalized anxiety my whole life since I was a kid, since I could remember. But at this point, I was dealing with severe anxiety. I had racing, disturbing, intrusive thoughts and moments of paranoia that felt really terrifying. I was really scared I was going to fall into psychosis. And what made it even more confusing was that at the time, I was a trained mental health therapist working towards licensure. So I had all the tools, I had all the education, I had all the strategies, but nothing I knew seemed to touch this. And I would even go to therapy. I would see other therapists because obviously it's very hard to treat yourself. So I would go to therapists and really not make any progress because the symptoms were so physical and visceral. So at the time, I kept trying to figure this out. How could I know so much about mental health and yet I felt so out of control in my own mind, I didn't know how to help myself. And it wasn't until I was lucky enough to get diagnosed with mast cell activation syndrome and started to understand the connection between mast cells, histamine, and the brain that everything started falling into place. What I initially thought was purely a mental health breakdown was actually being driven by my body's chemistry. But this was not an innate brain imbalance that psychiatrists often talk about. The brain fog, obsessive thinking, spiraling anxiety, these were symptoms of mast cell activation, and they could be, and were, corrected. So that's why I'm so passionate about teaching about this today, because if you're experiencing this, you need to know that you are not broken. Your symptoms are not just in your head. There's a biological mechanism behind what you're feeling, and many other people feel it too. So now let's dive into the science of what's really happening. Remember, mast cells are immune cells that release chemical messengers like histamine when they sense a threat. Histamine is actually one of many inflammatory chemicals that are released when mast cells encounter what they perceive to be a threat. Now, when mast cells become overactive, which can happen for a variety of reasons we won't get into in this video, large amounts of histamine and other inflammatory chemicals start to release from our immune cells. Now, histamine is not just about creating classic allergy symptoms. Of course, when we have elevated histamine, we'll have eyes water, we'll have cheeks flush, we'll have hives, we'll start sneezing, all of those classic symptoms you get when you have hay fever or a cold or you have an allergic reaction to something. But histamine and its other inflammatory counterparts actually also act as neurotransmitters, and there are receptors in our neurons to take up histamine And this causes an inflammatory and upregulating effect in the brain and nervous system and directly affects how your brain functions. Histamine is considered an excitatory neurotransmitter similar to glutamate, and so it's involved in things like wakefulness and sexual arousal and appetite suppression. So these are all very important things. Histamine has to spike to make us feel awake and alert in the morning, and to partly tell us when we're not hungry anymore. But when it's dysregulated, it can overstimulate the nervous system, and this is what leads to things like racing intrusive thoughts, agitation, paranoia, and panic. And of course, because histamine dilates blood vessels and changes our circulation, it can also leave you feeling really lightheaded, foggy, disconnected. And these are very, very common neurological symptoms that people share that they're having with MCAS. So this is why simply treating anxiety with a medication or going to therapy is not going to get to the root of these mental health issues if you have underlying mast cell activation. But the funny thing is that many common psychiatric medications have mast cell stabilizing properties. So it's actually unclear how many people out there who think they just have a mental illness and feel better on medications are actually medicating an underlying mast cell disorder. This is why it's so important for us to revolutionize the field of psychiatry and actually get to the root of why so many people have overactive mast cells causing mental health symptoms. Because if we address the underlying mast cell activation, these symptoms may fade on their own without the need of medication. So how do we do that? I talk about this extensively in my coaching programs, in my pre-recorded courses, and so if you're interested in really diving into this, please go to my website, wholebodyhealingwithjen.com, and look at my resources. But I'm just going to give some basic overviews. The first step often is using a low histamine diet, at least temporarily. Now, I always like to emphasize we don't want to be stuck on a low histamine diet forever, because if we are, that means we haven't actually addressed the root issues. But for a time, this can reduce the load off your system. So reducing foods like aged cheeses, cured meats, not leaving leftovers in the fridge, not drinking alcohol, not eating fermented foods, and mostly eating fresh meats, vegetables, and fruits is often going to just take your symptoms down right there. Now, the next step is starting to rebalance the gut microbiome. A lot of the triggers for mast cells come from gut dysbiosis, which is another word for the overgrowth of bacteria and parasites and fungus that produce histamine and other toxins. And this can trigger mast cell activation. So through targeted nutritional strategies and sometimes the gentle use of antimicrobial herbs when it's necessary, we can shift the microbiome dramatically towards a more balanced state. And this takes the pressure off the immune system and will usually calm the mast cell activation. Now, the third step is gentle detoxification strategies. Mast cells not only respond to things like bacteria and parasites, they also respond very strongly to environmental toxins, particularly mold and heavy metals. And so making sure we're supporting our liver and lymphatic system can make a big difference. So this can be as simple as making sure you're properly hydrated with minerals, taking Epsom salt baths, doing castor oil packs, and eating a lot of bitter and fiber-rich vegetables, as long as you tolerate those, that help your body clear the histamine and the toxins more effectively. Now, the last thing is we can't ignore the nervous system. Mast cells are tightly connected to our stress signaling. So learning mindfulness skills, practicing diaphragmatic breathing, doing somatic exercises like TRE are really essential for calming the brain. Safety cues will calm the nervous system, and in turn, the mast cells will be less reactive. But in my experience, we really need to pair these exercises with the nutritional and detox strategies if we want to see progress, because there are physiological mechanisms at play here. So, if you need support with all of these strategies, I really encourage you to visit, again, wholebodyhealingwithjen.com and start one of our subscription programs. And I want to emphasize, if you are struggling with anxiety, brain fog, and obsessive thinking, and therapy hasn't worked, and you're being told it's all in your head, even though you feel like there's something deeper going on in your body, I want you to know this. It may not just be a mental illness. It may be a symptom of mast cell activation syndrome. And by addressing the root causes of why your mast cells are activated. We can calm the mast cells, lower the histamine, and we do this by rebalancing the gut, supporting the detox pathways, practicing nervous system regulation, and these are the methods through which you can find real relief. It is possible.